A very good morning to everyone. I am Dr. SAICHARAN, MDS and Digital Smile Design Expert. Currently, I am working as a senior lecturer in the Department of Conservative Dentistry and Endodontics at Mahi Institute of Dental Sciences and Hospital, Mahi. I have completed my residency in Digital Smile Design from Spain under the guidance of Christian Coachman. And I am also official member of DSD Spain. So today, I am going to give a brief introduction about what is digital smile design and what are the patients and as well as the clinicians' perspectives. So here we go. Digital smile design, an innovative tool in aesthetic dentistry. So in this brief talk, I'll just cover these contents, which include the introduction, evolution of DSD, requirements for the DSD, photography protocol, videography protocol, the advantages, limitations, future prospects, conclusion, and references. Coming to the introduction, a beautiful confident smile is desired by all. When a patient wishes to attain the smile but is skeptical to undertake the treatment procedure for not being able to visualize his or her treatment outcome is when a clinician can use the digital smile design tool. So whenever a patient walks into a clinic, the patient is not confident about what is the final outcome of the treatment. So a digital smile design can help the patient visualize what could be the end result. So if the patient walks in with a problem, the clinician will be able to show different types of treatment protocols without even touching the patient. We can just take the videographs and photograph the patient, and with the help of the software and other tools like CBCT, etc., we can come up with the final outcome, digital outcome, and with that the patient will feel confident and be able to actively participate in the treatment plan, and the final end result will be much more satisfying for the patient as well as the clinician. So this DSD concept aims to help clinician by improving the aesthetic visualization of the patient's concern, giving understanding of the possible solution, therefore educating and motivating them about the benefits of the treatment and increasing the case acceptance. So as I told earlier, it helps in active participation of the patient, and which could help in customization of the smile design as per individual needs and desires. So as we all know, everyone's needs and expectations are different. It is very tough. We all know that it is very tough to now fulfill or meet the expectations of each individual. But with the help of a digital smile design tool, it is in a moment of a jiffy, we can fulfill the patient's expectations with a very less margin of error. And Coachman and Calamita described DSD as a multi-use conceptual tool that can support diagnostic vision, improve communication, and enhance treatment predictability by permitting careful analysis of the patient's facial and dental characteristics that may have gone unnoticed by clinical, photographic, or diagnostic cast-based evaluation procedures. So basically, we are planning to connect emotionally with the patient. So emotional connection will not come very easy. It comes with patient's acceptance. It happens very easily with the help of a digital smile design tool. The patient will be able to emotionally connect with the patient. There was a friend of mine who is practicing digital smile design for a long time. And in his clinic, there came a English person, a foreigner, who heard this doctor is doing a digital smile design treatment protocols, but he was not sure of his outcome. So he came in, he walked into the clinic, and he was asking the clinician whether he can fulfill all his dental work. So the clinician accepted the task, and when the scans were done, he couldn't find all multiple mutilated teeth, all grossly carious teeth, and his aesthetic concern was a big problem because all his anterior teeth were gone with multiple carious lesions. This was much before COVID. That time itself, he was wearing a mask because of the social stigma. He could not face the people confidently. So when the clinician took the scans and he has done a digital mock-up of how his smile can be transformed, the patient was literally in tears. That is the emotional connect you get with the patient. And when you get that emotional connect, he was not sure. He just walked into the clinic, and without being skeptical about going for the treatment or not, he promised the clinician that he is going to come back within few months, and he went back to his country, and he came back with some of his money. He has hard-earned money. He has brought back after 5-6 months, and he has completed the full digital treatment protocol from the friend of mine, the clinician. So why I'm saying this is because when you connect emotionally with the patient will be ready to pay. And it's worth mentioning that if you want a very good treatment, a very good high quality treatment, you have to there are few costs incurred with it. So the patient will also be happy to pay for the treatment. So when you go for a lesser treatment with lesser cost, we have to cut short some of the expenses, and the quality surely will come down. But whereas if you want to do a very good treatment, the clinician wants to do very good treatment, but because of the limitations, because the patient could not be able to afford, or patient is not willing to pay much, so there is no other go. But with the help of this digital smile design tool, a patient will be much more confident, and whatever the clinician promises, he can exactly replicate in the final outcome. This is how a digital tool can help transform the lives of both the clinician as well as the patient. So he is Dr. Christian Coachman, and he hails from a family of 6 to 7 generations of dentists. He is basically a dentist, but he is more towards the lab work. So he has given up his clinician work, and he has doing full-time the technical work, and he has one of the world-renowned clinics and digital labs across the world. So according to Christian Coachman, he has proposed few evolutions in the generations of digital smile design. The generation 1, if you see, it is just the analog drawings, the handmade drawings over photos, and there is no connection with the analog model, the impression or the final masterclass what we get from the patient. There is no correlation. They just take a picture, the photo, over the photo they use this handmade drawings, and they used to compare to get a very good result. But this was very a primitive way of doing the digital smile design, basically the smile design. In the second generation, there came this digital 2D drawings, and there was visual connection to the analog. Basically means they made this digital 2D drawings, and they were comparing with the analog model. In the third generation, the digital 2D drawings and analog connection was there with the model. In the fourth generation, this digital 2D drawings had this digital connection. Basically, they were comparing with the 3-dimensional digital model. In the fifth generation, it was the complete 3-dimensional workflow, which includes intraoral scans and comparing with the CBCTs, etc. Everything. So it is a complete 3-dimensional workflow. In generation 6, it's a 4D concept in which basically a video of the patient pre-op video will be taken, and the digital smile design will be incorporated into the video, and whatever the treatment is done, that will be visualized. The final outcome will be visualized in the same pre-op video, and that will be projected to the patient as a final outcome. How the final outcome can be visualized, that can be shown incorporated into the same video. Where rather the other 5 generations were dealing with the photos, rather the 6th generation is it deals with the video of the patient. So it gives more patient's acceptance when compared to the other 5 generations. So what are the requirements for the DST? We need a very good computer with the DST software, a digital SLR camera, or even a smartphone can do, but we can never beat this DSLR. But if you want to do with a smartphone, that's fine, but there are certain limitations. And digital intraoral scanner for digital impression, a 3-dimensional printer, a CAD cam, or additional tools which are required for the complete digital 3D workflow. And an accurate photographic documentation is essential for complete facial and dental analysis of the preliminary photographs. So these are the basic requirements. If you are not able to take proper photographic protocols, then we might go wrong because excuse me. Yeah. The photography protocol, it is very crucial, because if the measurements, if the magnification ratios, and if the photo quality is not precise, we might go wrong with the digital photography, digital smile design protocols. So poor photography misinterprets the reference image. So when taken properly, this will give an excellent result, and it will help a long way in treating the patient. So these are the basic photographic protocols what are required. So we require 3 frontal views. Let me show you the pictures. A full face on with teeth slightly apart, and the other picture with the lips at rest, and full mouth photographs. We need intraoral photographs at 1:3 magnification in a crop factor camera, and 1:2 ratio in a full frame camera. And these are the intraoral pictures what we need. So straight on, left lateral, right lateral with slightly teeth apart, and upper and lower occlusal, and upper and lower anterior teeth with the contraster in place, and 2 profile views we need. Yeah, can see here, these are the profile pictures what we need. Teeth slightly apart, and the other picture with the lips at rest. And we can see here the picture on the top. It is at 12 o'clock position, where we see visualize the smile line. So if there are protruded anteriors, forwardly placed upper front teeth, if the teeth are like going beyond the smile line when viewed from the 12 o'clock position, then it is a pure case where orthodontic intervention is necessary. If the smile line is perfect without much of the anteriors being forwardly placed, then it can go with the camouflage treatment, which can include composites, or which can include veneers, or whatnot. You can play with your treatment options. Whereas if the teeth are forwardly placed, it has to go for an orthodontic treatment intervention before doing whatever the other treatment is. So coming to the videography protocol, a facial frontal video with retractor and without retractor smiling, a facial profile video with lips at rest and wide smile, and a 12 o'clock video above the head at the most coronal angle that still allows visualization of the incisal edge, and an anterior occlusal video to record maxillary teeth from second premolar to second premolar with the palatine raphe as a straight line. So 4 complementary videos should also be taken for facial, phonetic, functional, and structural analysis. This is about the generation 6 of digital smile design, and still people are trying to master this. And if done properly, this videography protocol can help you visualize the treatment protocol in a big way. So what are the softwares in it? There are different types of softwares in the market, and being Photoshop is a gold standard software which can be used for digital smile design. And there is an digital smile design DSD app by Christian Coachman himself, and ExoCAD Dental can also be used. So it is about your application skills rather than the software. And this Photoshop will be readily available. And if you are a member of DSD official member, you can get accessibility to the DSD apps and the softwares. So this is about the analysis. 2 types of analysis will be done. First is the facial analysis and the dento-gingival analysis. So I'm just going to brush through what is. I'm going to give you a basic idea only in this short presentation. So basically, in the facial analysis, there are different planes. So according to the position of different planes, which are measured using your photos, the shape and size of the teeth will be decided. And when you go with the dento-gingival analysis, so there are different reference points like gingival zenith and all the position of the gingiva and everything, and based on which your shape and size of the processes will be decided. And there's something about golden proportion and all, based on which you will decide the height and the width of the processes which you are going to place. So here we can see in the first picture, the patient has come and they have taken the measurements using the digital software. And in the second picture, they are designing the taking the reference points and they are designing the smile line and everything. And in the final picture, you can see the proposed dental processes which are placed in the upper anteriors, and based on which they can readily print it with the help of a three-dimensional printer, or they can print it with a CAD/CAM machine or etc. You can see this is the analysis which is happening. Basically, people have an idea that the clinician doesn't have any role, rather the software is which is giving the final end result. No, it is not like that. With the help of the software, the clinician and the technician together, they plan the treatment outcome. That is how it works, not the vice versa. The software, if you just upload your pictures, no, the software cannot give you the final outcome. Rather, the clinician and technician should like sit together, and they have to decide the treatment protocol, customized treatment protocol to every patient. So in the final picture, you can see the proposed outcome without even giving a processes. So with such amount of confidence and emotional connect, the patient will be readily able to accept the treatment protocol happily, and post-op complications, like not on the clinical aspect, rather the patient's satisfaction will be utmost. Like he'll be 100% confident and satisfied with the treatment protocol. When he is paying you so much of money, and if he is not satisfied, he might not come back to you again. Rather, he might discourage some of his colleagues or friends who might come to you. So with the help of this digital software, you can be able to fulfill the desired expectations and patient satisfaction to the most. So coming to the advantages, it helps in visualization of the final expected result before the treatment itself. So it can help address the patient's concern by showing digitally the final outcome and motivating and educating them. So it helps in customization of the smile design by increasing the participation of the patient in their own smile design. And it helps in arriving at more aesthetically driven, humanistic, and emotional and confident smile. It not only helps improve communication between the clinician and the patient, but also between the interdisciplinary team members, between clinicians and a lab technician. And as I told you, it will help you a long way in marketing your treatment protocols. And come to the limitations, as the diagnosis and the treatment plan depends on photographic and video documentation. Inadequacy in them may distort the reference image and may result in incorrect diagnosis and planning. So for complete three-dimensional workflow, 3D softwares with updates, intraoral scanners, three-dimensional printers, and everything, all the equipment are required. And sometimes it can be economically expensive. But over time, if you're doing a very good clinical practice, you can cover up your cost within few years, a few months to few years. Training and handling of this softwares are necessary, and it might increase the time and cost, as I have told you. With proper treatment, of course, it requires treatment and some investment and some patience. Like if you're comfortable and if you're on it, you can get your treatment, as well as it will transform your way of treating your patients over time. So the future perspectives, I have told you. The cost of the digital workflow is not extensively used in the Western world. They are doing it big time, but in India it has just started, and because of the cost and everything, and clinicians adaptation is just started, and people are moving towards digital dentistry. People are learning the photographic skills and videographic skills, and sooner or later, within the next few years, we can expect people to transform. A lot of clinicians transform as digital clinicians. So with the improvement of the softwares in the next few years, it will become much more easier and much less cumbersome to do this procedure. And the 4D concept is what is in cards, and it's already started in the Western world, and slowly people are adapting to it. And compared to the three-dimensional workflow, that four-dimensional workflow will be much more it can motivate the patient even better. So, and even virtual reality glasses are available to foresee the desired smile in actual reality. So these are all the future perspectives. And coming to the conclusion, a digital smile design concept is a helpful tool in aesthetic visualization of the patient's problem. It not only helps patients to envision the treatment outcome, but also improves clinical diagnosis and treatment planning. These are my references, and thank you so much.